Good day everyone. Today we'll be discussing about nasogastric tube feeding. This is Karen Kalyangan, your clinical instructor for today. For the learning outcomes, first is to recall the steps in performing nasogastric tube feeding. Next is to visualize NGT feeding. For the third one, analyze nursing considerations needed in patient with NGT. And for the last, summarize the steps in performing nasogastric tube feeding. Tube feeding are administered to the patient who cannot ingest food orally but do not have problem with absorption of the nutrients from the intestinal tract. They may be used for short-term or long-term nutritional support. For the equipments we need a syringe, NG tubings, gloves, feeding formula, a stethoscope, and a glass of water. Let's go now to the procedure. First, check the physician's order for the type of feeding, amount, and strength of the solution. This is to ensure that feeding is given according to doctor's order. Assess the abdomen for distension or tenderness. Identify discomfort prior to feeding to avoid complication. Elevate the head of the bed 30 to 90 degrees. Elevations allows gravity to help flow the formula into the stomach and prevent reflux. Perform hand hygiene. Put on the gloves. Possible contact of body fluids requires use of gloves. Pinch off the tube and remove the cap or the clamp. Pinching the tube helps prevent fluid leaking from the tube. Check the placement of the tube. Attach the syringe and aspirate a small amount of stomach content, around 5 to 10 ml. Obtaining gastric or intestinal content is the best evidence of proper tube placement. When more than 150 ml of the residual formula are obtained, the physician should be notified because this is an indication that the feeding is not well tolerated. If no fluid is obtained, check the tube placement by introducing air through the tube and listen to the left side of the xiphoid process with the use of the stethoscope. Now the tube is in place, pinch off the tube, pour the formula into the barrel of the syringe, keep it no more than 18 inches of the level of the stomach. Formula should be given moreover 10 minutes or longer. Gravity will draw it in. Run it slowly over 30 minutes. Add the formula to keep the neck of the syringe filled. Continue adding formula to the syringe until the prescribed amount is given. If the formula falls below the neck of the syringe, air will enter the tubings and the intestinal tract, causing discomfort or result to distension. Flush the tube with 30 to 60 ml of water. Flushing tube helps prevent clogging. Remove the syringe. Clamp the tube by inserting the plug or covering it with a cap. Wash the equipments. Remove the gloves and perform hand hygiene. This is to prevent spread of microorganisms. Assess the patients for the evidence of discomfort, complications such as nausea, vomiting, and respiratory distress. Documentation should contain types of formula given, amount, verification of tube placement, and amount of residual if obtained, or any signs of intolerance of feeding. Let's go now to the medications given through NGT. When the patient cannot take anything by mouth but a feeding tube is in place, oral medication can be given through nasogastric tube. For the equipments, we need medication cap, pill crusher, warm water, syringe and needle, disposable gloves, medication sheets, mortal and pistol. For the procedure, first, check the medication. Performing 2 checks before preparing each medication and follow the 10 rights of medication administration. Crush each medication to be given that comes in a tablet. If it is liquid in a gel capsule, the liquid can be aspirated with a syringe and a needle. For the capsule, open the capsule and pour the powder into the medicine cups. Mix each medication with 30 cc of warm water. Correctly identify the patient by checking the identification band with the name of the patient. Ask the patient also to state his name if conscious or able. Place the patient in a high Fowler's position. Put on the gloves and attach the scepter syringe to the tube while keeping the tube pins off. Pour 15 to 30 ml of water to the syringe and add the dissolved medication. Follow the first medication with at least 5 ml of water before administering another medication. Follow the last medication with 30 to 60 ml of water. Pinch off the tube as the syringe empties. Clamp the tube. Leave the head of the bed elevated for at least 30 minutes. Clean up the equipment, remove the gloves, perform hand hygiene. Assess for adverse effect of the medication. Evaluate for abdominal distension or nausea. Usually, if you give feeding and medication should be given first before the feeding formula. Thank you and good day.